Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, according to the National Institutes of Health, we rely a lot on them for statistics,
It's a
don't
good
we?
thing they're there.
Well, what they told us about chronic pain, chronic pain that lingers, that it affects more Americans than diabetes, heart disease, and cancer combined. Chronic pain is, in fact, the most common cause of disability and is often treated with opioid pain medications. And we know that word opioid, don't we? And that means the medications like heroin, morphine, and prescription pain relievers. And, of course, opioids are not without some serious side effects, including the fact that they can be addictive.
In an effort to find better ways to manage chronic pain, clinical trials at Mayo Clinic are testing complementary therapies such as acupuncture, massage, and yoga as alternatives to medications.
Well, here to discuss complementary pain management therapies is Dr. Brent Bauer. Dr. Bauer is director of the Mayo Clinic Complementary and Integrative Medicine Program. Welcome back to the program, Dr. Bauer. Good to have you with us.
Always great to be here.
Chronic pain, a big part of your practice?
It is. We see a lot of patients who are looking for that next level of care for their chronic pain. In other words, we know that we can do a lot with conventional means, physical therapy, medications, but we also know a lot of those things have side effects. As you just pointed out, opioid epidemic has become a crisis for this country. So we really have to ask ourselves, as good physicians, how do we meet the needs of our patients in pain without opioids? And I think part of the answer, anyway, is integrative medicine, acupuncture, massage, mind-body training, a lot of things that may not be the full answer, but I think are really a good part of the overall approach.
When we're talking about pain, that's a pretty big umbrella. So you could have nerve pain or skeletal, muscular, there's lots of different, my feet have hurt, for years, whatever the situation. Are there different types of chronic pain, or how do you kind of break that out so that you can help patients more?
Yeah. So there are lots of different types, and obviously we think of some things like fibromyalgia, a muscular condition where the pain's kind of all over. Those patients seem to respond very well to acupuncture. We've had a lot of success here using acupuncture, never as the only answer, but as part of an overall approach. So we still want them into a cognitive behavioral therapy training. We want them to do physical therapy. We want good nutrition, good exercise. That's foundational. But then to bring along other things like massage, like acupuncture, as an adjunct to the overall care, we oftentimes see great responses.
Okay, fibromyalgia. What are some of the other ones?
Well, think of what we have in our country right now as an aging population. So osteoarthritis, lots of back pain, neck pain, hip pain, knee pain. And Dr. Shives takes care of some of those things very well.
But not all.
But not all. and surgery should never be our first answer. So we always want to try and see what we can do to make people feel better with other things before we get into the strong drugs, big surgeries.
What about headaches? Do you have some help for people with chronic headaches?
Yeah, we do. There's quite a bit of research, especially on migraine headaches, but also tension headaches, that acupuncture, again, very effective, not only for treating, but very interesting with migraine headaches, actually as a preventative. So people who have a propensity for migraine headaches get acupuncture on a regular basis, dramatic reduction in the number of headaches they get.
When you say regular basis, that might be the key part of this conversation, because if people are taking pain relievers for whatever ails them, they would be taking it multiple times a day or at least once a day. Mm-hmm. Do you have to have acupuncture performed once a day or multiple times a day to see that same sort of benefit?
Hopefully not once a day.
I would like it, but I just have to find time in my schedule for it.
Well, what we see with a lot of things, it kind of depends on how acute the pain is. So if somebody just hurt their back and they want to use acupuncture as part of it, might be 2 treatments a week for 3 or 4 weeks just to kind of put the fire out, so to speak. Somebody who's dealt with chronic pain for years and years might get 6 or 8 treatments over a month, but then maybe need once a month as kind of a maintenance schedule. Because I think you're absolutely right. Some of these things are not cures. We don't cure the pain, but we can actually help deal with the symptoms. So it's very reasonable that some people get a massage once a month or twice a month indefinitely.
How do the acupuncturists and yourself decide where to put the needle? I mean, if you've got pain here, you don't necessarily put the needle there.
No. Unfortunately, I don't help them decide at all because I don't know the first thing about where to put an acupuncture needle. But these guys go through a lot of training, and we have both licensed acupuncturists who follow the more traditional Chinese medicine realm, which is where we think about the flow of qi through the body, these energy panels or channels. And then we have our licensed or our physicians who have gone through acupuncture training. So they're both coming at from different paradigms, but they end up using the sort of the same points. And they have a long history of how those points were chosen. And you're absolutely right. Where the pain hurts isn't necessarily where you're going to put a needle.
It's interesting that Eastern medicine and Western medicine are coming together in acupuncture.
Yes.
Don't you think?
Oh, yeah. Well, I think everything's coming together in this realm. We've done 17 studies here at Mayo Clinic on massage and postoperative pain, pre-procedure anxiety reduction, and we've had tremendous results. That's why we now have a number of massage therapists as part of our staff. So as we look at the evidence and we find things out here that might have once been called complementary or alternative,
Fringe.
and as we start to say, no, there's evidence, can we marry them with the best of conventional care? That's Mayo Clinic. If we put the two together, can we integrate them? And that's why you hear this term integrative medicine. We're integrating the best of conventional with the best of evidence-based complementary therapies.
So where do you get your patients? Are they all referred to you? If I had chronic pain and I wanted to bypass my physician because for whatever reason, can I come directly to you or do I need a referral?
We want a referral. And that's to that very point. We don't want to have us say one thing and their primary physician say another. So we see this as a very collaborative opportunity. We want to see our colleagues' patients, but we want to do it in a way that whatever we recommend is a recommendation back to them. So we're all on the same page. I don't want to tell the patient to use acupuncture, but there might be a reason that their primary provider doesn't want them to use acupuncture. So it's a dialogue.
I'm so curious, and I just have to ask this. Patients come to Mayo Clinic from around the world. Do you see some raised eyebrows when maybe they've traveled here from hundreds and thousands of miles away, and then you say, well, let's see where some massage might be able to help with this, or some acupuncture, and do they think, at the Mayo Clinic? Is that something that you're getting from patients?
Not as much anymore. We've been
Okay.
around with this integrative medicine program for 20 years. We've done tons of research, lots of books, DVDs. I think Mayo has a good reputation in the wellness realm now. And a lot of these other cultures, people from overseas, a lot of those cultures have massage, mind-body treatments, yoga, tai chi as part of their healthcare paradigm. So in some regards, they look at us like we're catching up to what they knew. And that's fine. I think what we are doing is trying to integrate the best of both worlds.
You've been doing complementary and integrative medicine for a long time now because we've had you on the program multiple times. What is it what surprised you the most about the whole field?
Well, I think probably surgeons more than anything else.
Because what do surgeons tend to think about what you're doing?
Well, you would think perhaps like at a place like Mayo Clinic, which is largely founded on a reputation of fantastic surgery, where we tend to be kind of conservative. Some of the earliest adopters were our surgical colleagues who saw a benefit for postoperative pain and said, yes, we'll make massage more available. We'll hire massage therapists. So it really was an effort that really blossomed here because of our surgical colleagues.
Let me ask you one more thing. We know that the supplement industry, people spend billions of dollars every year on supplements, and lots of different stores sell them. Can you name me a supplement or two or three that actually does some good and what it does good for?
Sure. So that'd be another conversation for another day in great detail. But a couple thinking about chronic pain. A couple that I use quite a bit, one of which is called SAMe, S-adenosylmethionine. That's why we call
How
it
do you
SAMe.
spell SAMe?
S-A-M, all capitalized, small e.
SAMe, okay.
So SAMe. So that's actually got some pretty interesting studies on osteoarthritis pain. Now, the other thing it has is some pretty good benefit on depression. So if you think of some of our older folks who might be a little depressed, have osteoarthritis, but can't take an anti-inflammatory because of gut irritation, kidney function, and so forth. So that turns out to be a very helpful one. The other one we've been using quite a bit is something called curcumin, one of the derivatives of turmeric, which has some good anti-inflammatory effects, and some patients get benefit from that when they can't tolerate the NSAID. So there is evidence for some supplements, but they're not the first thing we reach for. They're not the cure. They're always part of an overall program.
You mentioned acupuncture and massage, but we have yet to bring up relaxation techniques, yoga, and tai chi. We can kind of lump all three of those together, but
Yeah.
how do those help patients?
So there's no question, all those things which I put under the category of mind-body therapies will do relaxation. They will reduce pain. There's been a number of studies showing that. And the nice thing is anybody can do them, right? So if you're not into Tai Chi, you can try yoga. If you're not into yoga, you can do meditation. You can't do meditation, guided imagery. There's a lot of different modalities within the mind-body realm. Almost everybody can find something that fits for them. And a lot of these things can be delivered by a CD, online, learn it once, and then you can practice it for the rest of your life.
Dr. Brent Bauer, always great to talk to you. And, I'm kind of high on this SAMe stuff. It's good for osteoarthritis and depression. Why wouldn't you not just take a little at this age?
We've been talking about complementary therapies for treating pain with Dr. Brent Bauer. We're going to take a short break, but when we come back, we're going to learn about Mayo Clinic's new endeavor, the Well Living Lab, studying the connection between healthy living and our indoor environment.
Plus, myth or matter of fact, Americans spend 90% of their time indoors. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shive.
And I'm Tracy McRae.
We are back talking with the director of the Complementary and Integrative Medicine program at Mayo Clinic, Dr. Brent Bauer. Dr. Brent Bauer is also medical director of a new endeavor called the Well Living Lab at Mayo Clinic. So, Dr. Bauer, how about this myth or matter of fact?
Well, this is an easy one.
Oh, wait a minute.
Oh,
No,
wait.
let me say it again,
Yeah.
because some of our listeners might have forgotten. It was a long commercial break. Here it is.
So, how about this myth or matter of fact? Americans spend 90% of their time indoors. Is that a myth? Now, I don't know if we should talk about Minnesota in the winter or not, but is that a myth or a fact?
On average, it's a fact.
I guess we could say Florida in July, same kind of deal, right?
If you think about it, you go to bed, you're probably indoors. You get up and eat, you're indoors. You probably transport to your work inside in a car, bus, a train. You're at work. Most of us work inside. So when you look at that 24-hour day, most of us spend about 90% indoors, which is huge if you're going to think about wellness.
And how does that translate into the Well Living Lab? And what is a Well Living Lab?
Great questions. So if you think about it, we really want to be healthy, right? We're promoting wellness. We're talking about exercise, nutrition. But what if your indoor environment is working against you? What if we have too many volatile organic compounds in our air here that's actually hurting us? What if these lights are actually turning down our melatonin at the time we're trying to go to sleep? So what we understand now is there's a lot of research that says the indoor environment can really affect our health, sometimes negatively, but I think more excitingly, can we use that knowledge to make our indoor environments healthier? So that's what the Well Living Lab is trying to do. We're creating actual spaces. Right now we have an office where we've brought Mayo employees with their computers and plunked them down into an office where we can manipulate the lights, the sound, thermal comfort, air quality, and see.
You've made them into living lab rats.
We prefer to think of them as research volunteers.
Okay, right. That's what I meant to say.
But they're allowing us to manipulate the environment around them, and then we can actually watch through cameras, through sensors, which are embedded throughout the entire office, bands that they're wearing that collects biometric data from them. So we can actually look and see what happens when we change the lights. Can we make them more productive? Can we increase their sleep at night?
Can you change the air quality in the room?
We can. We can make it a little worse by bleeding in some air from the street. Like
What about
some exhaust fumes?
burned microwave popcorn? What does that do to the folks?
we haven't done that particular study
You
yet.
totally need to study that.
But yeah, but those are the types of things you think about. How do we use the environment to enhance health? So I think the burned popcorn smell is a negative, but are there aromas that we can infuse in the air safely to increase productivity, alertness? Are there things we can do with the environment to make us more likely to move? So I think as we start to think of the proactivity that we can bring to, and now think about our huge enterprise here, if every employee had a more ideal wellness space, if you will, where they're working, what would that do for our healthcare costs? What would that do for productivity? And more importantly, what would it do for us as individuals with quality of life? So it's a huge opportunity.
Well, I would also think that all of the patients that are in patient rooms on this campus and at all the Mayo campuses could benefit from this type of research as well.
So the lab was built to be very configurable. So right now we have 6 different modules, each of which can be turned into a hotel room, an apartment, a closed office, open office, and every one of those is a completely censored environment where we can look at all these different things. So if you said, let's look at how old people do when they're in their home, we can bring old people into the lab, create an apartment for them, and actually watch everything they do, see what the floor sensors can pick up their walking pattern. We can look at how they cook, what they eat. I think we can learn a lot, and then we can translate that into their homes. What sensors do we need at home to be safer? How do we track our environment when we're out of the lab, so to speak?
The Well Living Lab, it is called, and I know you haven't been doing this for too long, but what's the most interesting thing you've learned so far?
Well, I think we've confirmed what most people would expect, and that is that women tend to like it warmer and men tend to like it colder. That seems to be coming out as one of our early findings.
Is that right?
But
Yeah.
what makes the office more productive, the warmer or the colder?
Well, and I think that's going to be the key, is to find the sweet spot where most of us can be comfortable. But now let's dive into what can we do in the microclimate? What can we do around the individual? Because if you like it warm, I like it colder, that could be a fabric solution where maybe the clothes we wear can help us be hotter or colder. The chair we're sitting on could have heating or cooling elements. So it's really kind of interesting to think where we might go in the next 6 months, a year, as we learn more about how do we make the individual comfortable once we've made the overall environment as optimal as we can.
So you think, what's the ultimate goal? To, I am sure, improve patients' lives, but in terms of the Mayo Clinic itself, to improve productivity? Is that the main goal, or?
I don't think it's the main goal, but it's an important goal, right? If we find out that turning the HVAC, the heating air conditioning system up 10 times makes air quality better, so we're healthier, but the cost is in the millions of dollars, that's a hard sell. But if we can show that changing X at a cost of Y increases productivity such that we more than pay for that change, now we're making people healthier and we're not hurting the bottom line. So I think there is an economic question here. We can't just be pie in the sky. The other thing I want to do is I really want to help people answer the question for what should I do in my home? Should I have a different air purifier? If I can't rebuild my entire furnace system, maybe there's things I can do to mitigate some of the negatives. What is the best lighting for my child? What's the best air quality for my child with asthma? And what can I do at a relatively inexpensive level to make those things better in their environment?
When do you think we might have the answers?
I think we're going to unroll answers on an ongoing basis.
Right here on Mayo Clinic Radio?
Well, of
One
course,
at a time.
My favorite place to ever come and talk about new and exciting things.
I just wanted to make sure we had that set. So, and there's really no end to the things that you can study.
No. In fact, it's very interesting as we start to talk to a lot of different companies, a lot of aging programs and so forth. People are very interested in taking what we learn in the lab and then bringing it out into the real world. So in other words, could we wire 500 secretaries spaces here at Mayo Clinic? Could we go across to one of our aging in place programs and wire up their rooms and learn at a much, much higher level based on what we find in the small space here in the lab?
And who is funding your research?
This is a great collaboration between Mayo Clinic and Delos, D-E-L-O-S. Delos is a company that has been working on this area for a long time. They've created the well building standard. So they've looked at all the science and tried to come up with the optimal air quality, lighting, sound, to kind of give a basis for how do we make the environment better for people in an office space.
Pretty exciting stuff. Dr. Brent Bauer, we've been talking about the connection between our health and our indoor environments. He is the medical director of the Well Living Lab at Mayo Clinic. Dr. Brent Bauer, again, thanks for being here.
Always great to be on.